Today we have Jillian. She's been working very hard at the desk, having some neck tension due to standing, but also you have a standing desk. So I just want to share this with you because even standing, I use an analogy that sitting, it's considered the new smoking, but standing is like vaping, right? And I'll explain why, because we're not really meant to stay in one position all day. Even when you're standing, you're still putting pressure on your shoulders. Yes, it's less, you're spending more energy overall, but there's still tension on the neck. So you have been feeling a little bit more neck tension last few days. Okay, any headache? Okay. Let's check range of motion. Turn your head to the right. Okay, that's pretty good. Do you feel any pain, anything?
Yeah, it pinches right through here.
Pinches on the right. Okay, now go to the left. Okay, that's much better. So any pinching on the left?
No, it stretches here.
Stretches on the right. So just, yeah, right hand. So one thing is I do feel tension where the SCM muscle attaches, which is this front muscle, and it's putting pressure on the suboccipital region. So typically when you have tension in this region can cause light headache, can restrict range of motion. You might experience brain fog, and then sometimes you even have hard time finding words when you're talking, and that's due to the pressure on the suboccipital region affecting proper cerebrospinal fluid flow, which is the fluid that runs on the spinal cord and brain, and then oxygen flow. So what we're going to do here, we're going to use two type of shockwave to help her. So we're going to start with a radial pressure wave, the jackhammer one. The beauty of our system in technology is that we have what is called Atlas applicator, which is designed specifically for this region. So this is much more powerful than manual techniques and released. Yes, gentle, bearable, and efficient. So what this is going to do is going to release the fascia in the suboccipital region, and then we'll treat the muscles to loosen up the tension, and then we're going to use focal shockwave to even go deeper. Obviously here there's no 4 inches depth, but because it's the neck, but that's how deep the focal shockwave can go and do the release and stimulate regeneration. So let's start with the Atlas applicator because this one has a silicone tip. We don't really use gel in this case. And the main reason is because I'm trying to get more fascia release and hit that very superficial layer with radial pressure wave. I know, too bad you cannot see it exactly where I'm hitting, but I just went both sides, and then I hit a little bit more the ligament nuca, which is this one where the upper trapezius muscles attach, and typically when we hit those, it helps the muscles loosen up. So now we are applying ultrasound gel that is required for conduction of the energy. And every time when we treat the neck, we always treat everything from the base of the skull down, because if I just treat the upper cervical region, and it's almost like treating the tip but not the root. And when the neck starts feeling tight, there is a lot of shoulder involvement, and therefore we have to reset. And there's a pattern that we start from the top all the way down, and then we treat the muscles here. So now we are doing radial pressure wave, but completely different applicator. So now she feels the energy going through more, and we're targeting that upper trapezius trigger point. And radial pressure wave, it's very successful treating and disengaging those trigger points very quick, because we can reach 2 inches deep without hurting even a single cell. Do you feel it there? Does it hurt? I know. It feels like a good pain. Wow, like it's right there. The reason the wave doesn't reach that deep, but the vibration transmits. And when muscles contract and kind of spasm a bit, then it causes that feeling. And this is safe, because if you go and read on internet, and especially practitioners that are not properly trained, or they have zero training in shockwave therapy, they think that you cannot use shockwave in this area due to the lung tissue. That's not true for the radial. It's true for the focal at high energy. We, as a clinic, daily we treat, I would say, 5 to 8 sessions a day doing this neck protocol, and it's extremely safe when it's used properly. We always must treat both sides, because especially with the neck, you don't want to just treat one side or one spot. You can initiate cascade of compensation, which is not good for the client. And wherever the pain is, it doesn't mean that's where the cause is. So I just had a client this morning, and yes, they were treating the right shoulder because that's where the pain was. And it was actually coming more from upper cervical. What happened is when you treat just the symptom, you use, heat, you massage like tennis ball and all that, you can over relax the muscle. And now the muscle hurts because it's in survival mode. It's over relaxed and it's trying to gain some tightness because the job of the muscle is to support stability. So not always a tight muscle needs relaxation or release or strengthening. We need to understand what is that muscle doing at that time, and then based on that, come up with the approach, whether we strengthen it or stretch it. So this is another technique that I love doing. Turn your head all the way to the right. No, look to the right. There you go. We go and release the scaling muscles here. It's less painful than if we do it manually with hands, and yet way more powerful because she had restriction of the range of motion on the right. This is so good. These are very advanced treatments, and this is what actually differentiate Unpain Clinic when it comes to shockwave therapy. After doing 40,000 treatments with shockwave, I was able to create protocols that focus specifically on treating the dysfunction while we are stimulating healing and regeneration. This one is tight there, like right there. See how her muscle, it's like the SCM upper trap, it's sticking out a little bit more up here. In many cases, radial pressure wave, it's not enough because on the neck, we cannot go too high with energy. We cannot really use applicators that can reach deeper, but this is very beneficial for the superficial fascia of the neck. And then we do the focal where we can go in and release, because the focal is pure sound wave. That's the true shock wave, and there's no pounding. So it's just pure sound that travels through the cells, releases deeper fascia. So now we are changing the applicator. We're going from 15 millimeter to 20 millimeter. It's like bigger. And what we do here is when you're sitting at the desk constantly, these muscles get tight and short. And then what happens is they disengage the scapula on the back. And then your rhomboid muscles are like length stretched, and they get tight because they're trying to pull back. But naturally, the pec muscles are much stronger. Sorry about that, Jill.
Okay.
See, normally it doesn't hurt that much, but when it hits the tight spot, you really feel it, especially the pec minor. Did you work out yesterday? Did you do chest? That's why you might be a little bit more sore today, because I can feel how the muscle, it's tight and thick, the consistency. So it's not just the desk. This is a muscle that was just used yesterday, but radial pressure wave now, it's going to be so beneficial for it. We just did 1,000 shocks on this. On the right side, I can see it already how the shoulder is positioned. So you might feel it even more. Sorry about. So now we go with a focal shockwave at very low intensity. We're going to go back to the occipital muscles, because now reaches much deeper to the levels that literally is impossible to relax a muscle this deep, this quick with anything else. So if anybody told you that you cannot get shockwave on the neck or upper cervicals, clearly they have no clue what shockwave therapy is. Just for comparison, in Europe, this specific type of shockwave is used now for Alzheimer treatments directly in the brain. They use it during open heart surgery. They use it on wound healing. So it's extremely safe because there's no heat or cold release. It's just you need to know how to use it properly. That's it in the end of the day. And the reason why I know this is because I've been doing shockwave since 2011. I teach and certify practitioners around the world through Medical Shockwave Institute. And if you want more information about that, go to iloveshockwave.com And you can see practitioners that I've trained and certified in proper use of Shockwave. So usually people that experienced whiplash in the past, this becomes a chronic problem, or concussions, and many symptoms don't actually clear because of the tension in upper cervical region. And chiropractic adjustments are very good for that, but then sometimes they don't hold because the soft tissue is so tight. And that's why Shockwave works amazing with chiropractic adjustment combination with physiotherapy. Then the rehab program, whatever you do, it's going to stay because Shockwave has released the tissue, but also has stimulated regeneration. And when it comes to injuries, specifically when you have a tissue injury, it's almost like having a cavity in your tooth, and brushing your teeth is like doing the exercise. So once you have a cavity, you cannot fix that by just brushing your teeth. So most of the injuries specifically, most of the time you cannot really fix them by exercising. You need technologies or treatments like Shockwave, MTT, stem cells, therapy, anything that stimulates tissue repair and restored healing response, then you can help it with exercise. And that way it becomes very beneficial for those chronic cases. Do you feel it there? I know. Do you feel it on the back by any chance? Yeah. Goes pretty much on the shoulder blade area, but this posterior scalene upper trap is very, very tight until today.
This is my injured shoulder still.
So can you share your experience with your shoulder? Jill had a shoulder injury from playing volleyball, and as soon as we found out what was happening, we did a few sessions of Shockwave and EMTT, and it worked very well.
Yeah, within 4 weeks I was back playing.
Yeah, 4 weeks back playing. That's amazing.
Pain-free.
I'm going to go specifically now to this upper trapezius trigger point, like right there.
You just watch my whole shoulder relax.
Okay, now we're going to do the other side. Turn your head all the way to the right. So we expect, in her case, because it's a more postural compensation and tightness, usually just go straight and relief. There's no much soreness expected the following day. But typically in chronic cases, when we release the neck and those muscles, you can experience soreness for about 72 hours, or it might go straight and relief. But when it goes straight and relief, we say don't test it. The healing hasn't kicked in yet. It's just the alarm system, it's down. The muscles feel better. Just continue whatever you have been doing. And then second, third session, once we see that your body is stabilized, has accepted the new change, then you can increase the activity, intensity, and do more and more. We're not doing much on the left. It was just for balancing purposes. Turn your head to the right all the way. Oh, is it still pulling?
I can still kind of feel it, but barely.
Okay. Is it still the same spot?
Yeah.
Okay. So now turn your head to the right and guide me to the
Oh,
pole, like right there.
you felt it too?
Yes. What's the pain level out of 10?
No, it feels so good.
Oh yeah. Bring your neck back to neutral. Okay. Now go back to the right.
Right there.
See, this is the advantage of the Shockwave because we can literally hit exactly. It doesn't matter how deep the spot is. We can treat and detect it where it's actually hiding. And then because we are shooting that with sound waves, your immune system, your body will send the cells to do the repair. So it's not just releasing, it's actually initiating repair in that spot. Oh, that's where it is, like right there. Okay, let's retest it.
Yeah, feels much better.
Awesome. Thank you, Jill. Yeah, it's all good. I'll just clean up everything. This is a technique that we do it in the end. We don't wash your hair, we just brush off the gel in the nicest way possible, That's it. Thank you. If you have neck pain, neck tension, headache, whiplash, post-concussion, even a C-section, appendectomy, breast augmentation, tummy tuck, that usually contributes to neck pain, and you probably had no idea, we can truly help you. Have a lovely day wherever you are.